welcome to India Top Doctor. Today we are back with another episode of the Swasthya Samvad. And today we will talk about asthma and related issues. There are many diseases in the world which people sometimes make the mistake of ignoring them. One of these diseases is asthma, which is also called asthma. This is a disease in which there is a swelling in the respiratory tract, and due to this, people start having difficulty in breathing. In winter, the problem of people suffering from this disease increases a lot. And due to increasing air pollution, its cases have started coming to the fore even more. In this corona period, asthma patients need to be very careful because it can increase their problem very much. To know more about this, let's welcome Dr. Ramnesh Prasad, an orthopedic and child specialist in Singapore Nursing Home. So welcome to India Top Doctor. आज आप जानते हैं हम अस्थमा के बारे में बात करेंगे. तो स्टार्ट करने से पहले हम अस्थमा के कॉजेस के बारे में आप हमें अगर बता सकते तो.
Asthma is a condition of respiratory tract in which the airway gets inflamed, swollen, and mucus are plugged, and there is difficulty in breathing of the patient. There are two types of asthma. One is acute asthma or chronic asthma. Chronic asthma is a condition in which there is narrowing of airways due to inflammation, and there are some triggering factor which leads to asthma.
So what?
And other hello.
Yes, sir. You were saying.
The causes of the triggering agents which leads to asthma are pollens or mites or cow dungs, dust, pollution. These are the pollen grains of the flower or cool airs. This leads to aggravate the symptoms of bronchial asthma.
Okay, sir. Is there some things a patient can change in his or her life to reduce the risk of asthma attack?
They can reduce the attack by, they will not able to expose to the pollens. If they are not exposed to the triggering factors like pollens or mites or cow dungs or ये पेशेंट अपने समझते हैं कि भाई हमको इस चीज से मतलब दिक्कत होता है. They feel that these things leads to bronchial asthma, then they decide that they keep themselves away from that triggering agent.
Okay. And what are the symptoms and signs of asthma?
The symptoms of bronchial asthma are difficulty in breathing, chest discomfort, pain in the chest, cough. These are the symptoms of.
Sir, there is a network issue in your side.
Achha.
Your video is stopping.
Oh. There are symptoms which leads to. अभी ठीक है?
Yes, sir.
The symptoms of bronchial asthma are chest discomfort, difficulty in breathing, cough, and shortness of breath, anxiety. These are the symptoms of bronchial asthma.
Okay, so when a people is, he or she is diagnosed with asthma, what are the things that feels in their throat? What kind of situation or things they feel in their throat? A person who is suffering from asthma.
They feel discomfort. There is difficulty in the breathing and chest discomfort are the symptoms they feel.
Okay, and how long, can you tell our audience how long does asthma cough last?
Cough lasts for 3 to 5 days. In some patient it can last for years also, and some patients gets relief with bronchodilators, or if they are taking the drugs like steroids, antibiotic, and bronchodilator, then the symptoms disappear.
Okay, so let's talk about from the beginning, right? What triggers asthma?
The triggerings are pollens, dust, cold airs, and mm, cow dungs. These
So,
are the triggering factors.
is there anything they can do to prevent it? Like, so the prevention.
They can prevent, if they are not exposed to these things, they can prevent themselves.
Okay. And does asthma worsens with age?
Yes, it worsens with age. The airway gets narrows, and which leads to aggravation of bronchial asthma.
Okay, so we have talked about causes and how things cause asthma and what kind of discomfort they feel. But can you tell me how is asthma treated?
Asthma is treated by antibiotic, by steroids, and by inhalation, like bronchodilators are given. In bronchial asthma, there is bronchoconstriction. That's why we have to give bronchodilator like salbutamol, ipratropium bromide, formoterol.
That's it.
That's it.
And I have just one last question from you. You are a frontline worker. So, as a frontline worker, what are the challenges you face on a daily basis, and how do you keep yourself protected for you as well as your family?
We wear a mask to protect ourselves and the family. Hand sensitizers is done by us, and we take care that we don't get exposed to the public places.
All right, sir. Thank
These
you
are
so
the
much.
things.
Thank you so much for being here with us. It was great talking to you. Thank you, sir.
Thank you.